Good morning, my students. Okay, it's before my class, so that's, I thought, a good time to practice this. First aid and bandaging. We're gonna do a portion of it today. I don't like to overwhelm my students because they have a lot on their mind. This is a level 3 school, I believe. So above, as far as, I won't get into that. Anyway, these kids have a lot going on, so I don't like to put too much where they can't absorb it. I want them to absorb whatever they can, and the one thing that I always stress, dial 911 if you have any questions, because they'll have they'll guide you through whatever you need. So any type of injury or issue, dial 911. If nothing else, they can talk you through it. Okay, so first aid, why? Or what is it? It's giving immediate attention to someone that's become injured. Okay, basically, that's what it is. It helps to bridge the gap between the accident or whatever happened and the arrival of the person that's going to give them medical attention. Now this thing, right there, says physician, but as we know, physicians don't generally come out unless there happens to be one there. So we're going to say EMTs or someone that's there. Usually those are the ones that we'll start with before they get to the hospital. You and at that point, and your medical assistants step aside and let them do their job because they have medical training. They know what to do, especially with injuries. You want to make sure to not impede on that so it doesn't cause more issues and injury. Okay, why? Objectives of this particular thing is to prolong life, alleviate suffering, and prevent further and added injury. Now, I'll get into that in a little bit here with something else. So, what are the characteristics of good first aid? Right there. Observant, notice all the signs, resourceful, make the best use of all things. There we go. Now I don't look like a half a person. Gentle, shouldn't be causing the pain. If you see like a protruding bone, don't press on it, something like that. Be mindful of what you're looking at, and if there's something that does not look normal, I would not touch it, especially with bare hands where we have germs and viruses on them. Wash your hands, put gloves on. Be very, very gentle. Use a padding if you've got to hold something down so that it's gentle on the person's injury. Tactful, don't be alarmed. Try to keep the straight face no matter what, and be sympathetic. Know that they're in pain. Understand if they yell or curse or something, they're in pain, okay? It's kind of normal. All right, here are things in the first aid kit. Now, first aid kits, I'd noticed when I was ordering one, come in all different sizes and different things in there. Sometimes they have just gauze in there. I have one in here. I'll show you this. And it's very messy. So I'm gonna have my students go through it, and we're gonna use this particular list there to see what all we got. There's just a couple things that I don't have in here. What was one? A regular bandage. I think I can get one from the nurse. A pen light. We don't need pen lights. We have phones for that. Well, of course, a pen light would actually be easier. If you're holding that, and you could set it down on something, because if we lay our phones down, then they lay flat, so you have to prop it up. So maybe a different kind of light so that you can look at an injury better. This particular list says forceps. Not sure why we would need that, so I'm not gonna press and impede on that very much. Medical tape, I have tweezers, splints. I don't have splints, but I have a nurse like 2 doors down, so we just run over there. That's what we do. So I just need the basic things, and I need a few more things. And I have rubbing alcohol, or no, I have not rubbing alcohol. What is this called? Hydrogen peroxide. I have hydrogen peroxide. I have 6 faucets, so running water to clean something. Anyway, but for a kit that you would carry along with, you'd want, where are they? Here they are. Alcohol wipes. Those work too. Just getting a bunch of those, and that way you only use 1 or 2, or for small things. Bigger ones, well, that's a different story. So we're not going to do the bigger first aid today. So I am taking this to the wound classification. It's the break of the tissue or the skin. So there's internal wounds and there's external wounds. Now you have to forgive this particular PowerPoint. I did not make it up, but it says breaks the continuity of the tissue, either external or external. Well, that's obviously a typo, so they meant internal or external, or an explosion, which is what would happen when there's a huge open wound. Signs and symptoms, clearly pain, swelling, discoloration, hematoma, which is blood pooling, uncontrolled restlessness, thirst, shock, and vomiting. Lovely. Types of wounds that are closed. Contusions, most commonly known as bruises, caused by blunt force trauma that damages underneath the skin. Now, I get bruises constantly. I mean, you could go like that and I would get a bruise. I think that's a vitamin deficiency. I've never figured out or kept in my memory. Okay, so I have looked at a lot of things, but my memory is really not so wonderful. And it is a vitamin type issue, but to bruise that fast, but it is dangerous. So if you see a really huge bruised swelling area, you want to get that looked at because something else could be going on. So not just the little brown bruises that you get when, you know, someone smacks into you or you smack into something, not necessarily that, but if it grows, yeah, then something's going on. Strained muscles that have not been warmed up, they could be cold, so that can, you ever heard of pulled muscle? Yeah, that hurts. Sprained ligaments. Okay, I didn't go far enough, I don't think. But that's a closed wound. Sprained ankle, that type of thing. The most easiest and the most effective first aid for that is rest, ice, compression, and elevate. I've had about 12 sprained ankles. I can tell you those are all accurate. And if it's a sprain, start walking on it as soon as you can. It gets it gone faster, and if it's worse than that, you may need to get it looked at. You may need some crutches, you may need a boot, something like that. So it depends on how bad it is. I mean, you can see pretty much when sprained ankles are at their worst or when they're just really light. They hardly have anything there. All right, abrasions. Here we go. Abrasions, superficial wounds, which are the topmost layer of our skin. So like something like this, see? I got a thorn in that one, and this one I just keep jamming it with my other finger. So the jamming one is just the top layer abrasion. It's just the skin scraped off. It's no big deal. Laceration, jagged, irregular, blunt breaks or tears into the soft tissues. And avulsion is forcible separation or tearing of the tissue from the victim's body. So where the thorn went in, that would be that last one there. Laceration is a cut. Here, I'm going to show you a quick. Here we go. There's the three differences. So there's the abrasion. Like that. There's the laceration. And there is the avulsion. All right. So there's the three different types. And again, it's like a level. You know, first level, second level, third level. And you definitely, abrasions, you probably don't need to call 911. Clean it out as best as you can. Covering it till the pain goes away. I don't know if that's accurate, but that's kind of what I do. I do keep things covered, but then I let them air out too. Like this one here, I covered it for while I was in and out of water yesterday, so I didn't want it to get in there very much. And now it's very soft and it's open. So I'm letting the air, the oxygen can heal if it's at that time, if it's ready to be at that time. So bear that in mind for just the small ones. All right, we got two more kinds here. Actually, my thorn would fit in the second one. So an incision wound where something was actually cut, or a puncture, that's where my thorn would fit in, which a sharp object penetrates the skin. So anyway, those are the different kinds. The major treatment for open wounds is direct pressure, elevation, because then the blood is not, you know, shooting to that area. It's going away from it a little more. It'll control the bleeding a little bit more. Prevent further contamination, wound dressing, bandaging, and then again, like I like the idea in the, I have to open one of these. I thought I had an open one. I don't. Of using a bandage that's not going to stick, because that will really hurt once they pull it off. There is such a thing as wound dressings that have a layer of something on there that will help make it so it doesn't stick so badly, okay? Immobilize the injured part and stabilize any impaled object. If someone is impaled with something, you do not want to pull it out because it could be hitting a major blood vessel. You can make the person bleed out. So keep it in there till the medical professionals come or you get to the doctor, one or the other. Do not remove anything that is large or in areas like a thumb. If you have something stuck in there, take it out, all right, finger. But we're talking like a wrist area, like right there, if something got impaled, or right here, you know, other places like that, don't take it out. Use your best common sense. Bandaging. Okay, so here's the different kind of bandages. And they include gauze, triangular, elastic, tubular, and tubular bandage, okay? Now for wounds that are real basic wounds, I would imagine either the gauze or here's that, the triangle one. That's how that triangle one works. Okay, so that triangle one is a really good one to use till medical professionals come or you get somebody to the doctor, because any bleeding that's excessive, that will help it a bit. That'll keep the hand protected, or the limb, I should say, whatever you're triangulating. It'll keep the limb protected and give a cushion in case anything bumps into it. So you can look up the triangle method, but basically it starts off in the triangle. Then you fold the top layer down, then one layer over, back and around, the other layer over, back and around. You see it? And then tie it. So that's how that would work. Let me see here. Those are slings. Here's a bandage for the forehead. So you start off on one side, you swing it around, and then to the other side again and tie it. For a neck, you want to press it, because that's where some of those blood vessels are that could, you know, and you want to tie it, but tie it loosely. You don't want to choke the person. You didn't die from the wound, you died from being choked. Okay, don't want that, okay? And ears and cheeks, they kind of do a crisscross type deal, you know, like you would in a present. So like that, you know, whatever it takes to get that a little bit covered. Then there's some other detailed ones that I'm not going to get into right now or for my class, because basically wrapping it and tying it enough, and it depends on where the wound and how deep it is. Like if you're trying to stop bleeding, yes, giving it a good tie is good. If you're doing it around the neck or up here, giving it so it stays, that's the idea. But they basically all go around two ways and then tie. Like here is one that would be a common, you know, if you just hurt your elbow, sprained it, whatever, or cut it. Same with the knee. Around one way, around the other way, and tie it. Okay, that is the real key to almost all these bandages. Round one way, round the other way. And if, like in this one where you keep going, see that? Whether it's the arm or the leg, so you do that a few times, then you do that and tie it then at that point. So there we go. There's just a few things that will help you if someone gets cut and they need a little bit of assistance. So thanks for listening. Appreciate it. Have a great day and stay safe.